Hi Facebook land, we're here with our first Ask a Professional series. I'm Sarah Coffman with Wichita Animal Action League, here with Dr. Kelly Jones from the Cat Hospital of Wichita. So we are answering your cat questions. We've got some that people asked earlier that we're going to start off with those. And then feel free to chime in and ask your questions as we're going, and we'll answer those in the moment. So Dr. Jones, why don't you introduce yourself and let them know that you're qualified to answer these questions.
I'm Dr. Jones. I've been at the Cat Hospital since 1998, and I work with cats only, so please try to limit your questions to cats. I haven't worked with dogs in a long time, so cats only.
Cats only. Okay, well, one of the standard questions that we always get in rescue is, my cat who has used the litter box for 10 years is suddenly not using the litter box. What's going on?
Well, what I always try to tell people is let's try to rule out any sort of medical problems that might be going on. Frequently what I get with people when they say, I've tried everything to get my cat back in the litter box. And the very first question out of my mouth is, have we tested a urine sample? And invariably they say, nope, haven't tested a urine sample. So, well, we haven't tried everything then. We need to check that urine first to make sure there's nothing medically going wrong with the cat. There are a lot of things that can go on with the urine that can cause problems that can make them go outside the box, as far as crystals, blood in the urine, cystitis, stones in the urine. These things can all be very painful and can make a cat afraid or too painful to go to the litter box. And they'll go outside the litter box, usually on soft things like bedding, carpeting, towels, even your bed. And they're trying to let you know there's a problem.
I have two personal cats that I always know when they're sick as soon as they potty on the bathroom rug. So the next question here, I take my kitty to the vet annually, but I've heard cats are masters at hiding pain. Totally true. How do I know when to take her in or not?
That's a really good question, because cats are masters at hiding pain. What I like to tell people is, when a cat is doing something unusual, there's something wrong with them. So for instance, if your cat likes to sit on your lap at night when you're watching television, and then all of a sudden it might be sitting on the floor or hiding under the dining room table, there's something wrong. Or for example, if it's not sleeping in bed with you, it's sleeping under the bed with you, it might not be able to jump up on that bed anymore. So a reluctance to jump up on things. If it's grooming excessively in one area, like say its lower abdomen, it might be having some pain in its bladder. Or if it's grooming excessively over its elbow area, maybe it's having some pain in its elbow. Or perhaps if it's not grooming, maybe it can't reach around any longer to groom its body. If it's not eating very well, if it's urinating outside the box, if it's sleeping in what I call the sick kitty pose, or if it's kind of hunched up and not sleeping in the comfortable position that you normally see it sleeping in. Those are all really good indications that your cat is sick or hurting. It typically is not going to cry out in pain unless it's a sudden pain. Say, for example, it just broke its leg. Yes, it may cry out, but it's not going to continue to cry out after that.
So this is actually a really great lead into another question about hyperthyroid symptoms. My personal cat, I called Dr. Jones and I said, she's acting weird, but I can't quite put my finger on what is weird. Like, she always likes to eat breakfast at 7 o'clock a.m. and now she doesn't want to eat breakfast then, she wants to eat it at 10 o'clock. And she was just acting off, but I couldn't really indicate what was off about her. So we started with a blood panel and found out that she was hyperthyroid. So what are some other symptoms that people can look for hyperthyroid disease?
Yeah, hyperthyroid, it can mimic other diseases. So hyperthyroidism we usually see in older kitties, typically over 9 years of age. It does occur in Siamese cats, which is what she has. It occurs in female cats more frequently than male cats, but we can see it in male cats as well. But typically the symptoms are weight loss when they're typically eating really good. They may have some problems with their bowel movements where they might have some constipation, but occasionally we will see diarrhea with it. But weight loss is generally the main thing that we see. Yowling at night especially.
Which is also another Siamese thing.
Yeah, but weight loss is the big thing. However, what I'd like to really emphasize is this disease can kill. If it's left untreated, it can lead to a heart disease that can lead to high blood pressure, and that can ultimately lead to stroke. So if it's left untreated, it can be fatal. So it's imperative that we diagnose this early and treat it.
Another question here, do all cats vomit occasionally? I feed my cat quality indoor cat food and comb her, but she still vomits. Is there anything else I can do for her?
Most cats vomit, and I guess we need to define what occasionally is, or what's normal for your cat. I would assume maybe once or twice a month would be normal for most cats. Any more frequently than that, something's probably not normal with the cat. So I guess I would say what's normal for your cat, and is it eating normally? Is it not losing weight? So if your cat is not eating normally and it's losing weight, there's probably something going on with it. Or if it's starting to vomit more frequently, you probably need to get it into the vet. But there are some things that you can do for your cat to help with the hairballs. Besides grooming and feeding hairball food, you can also give it the hairball remedy that you could buy at most pet stores and most veterinary clinics sell. What I typically recommend, and your veterinarian might recommend something different, but what I typically recommend is to use it once a day for a week, and then use it once a day after that. Also, fish oil or omega-3 fatty acids will help. How that works is it decreases the shedding, so they ingest less hair.
Another food question, why would a cat eat wet food and sometimes immediately throw up? Also, do you prefer raw food over kibble?
Okay, that's a good question. It's possible that the cat may just be eating too fast. So a couple of things that you could do would be to maybe just give the cat what I call an appetizer. So as an example, like when you go out to a restaurant and you eat an appetizer, once you get your entree, you might not be quite as hungry as you were when you first sat down for your meal. So just give your cat a small amount of the canned food, and then give it the rest of the canned food about 10 or 15 minutes later to try to slow it down. If the vomiting continues, you might just need to cut back on the volume of the canned food that you're giving, or maybe just cut out the canned food entirely. But it could also be the flavor of the food. Perhaps it's the fish, or just the ingredients in the food might be a problem. But as far as raw versus kibble, that you also need to define raw. Freeze-dried and raw are not the same. Freeze-dried is not raw, but raw food is not recommended to feed cats. I know there's a lot of websites out there and breeders out there that do recommend feeding raw to especially Bengals and Savannahs and things like that, but I do not recommend that. And also the AVMA, which is the American Veterinary Medical Association, and the AAFP, which is the American Association of Feline Practitioners, has come out with a stand on that, and they have said, no, do not feed raw to your cats. They are susceptible to foodborne illnesses just like we are, so they can get salmonella and E. coli just like we can.
As much as your cat thinks he might be a tiger, he's not.
He's not a tiger. Now, with that being said, they can eat raw things that they catch on their own outside, and they're fine. It's when we process these foods in factories, that's where the foodborne illnesses come in.
Perfect. Both of our cats get very itchy ears, and one cat gets chin sores after eating food that contains fish. Are these typical symptoms of a food allergy?
It can be. If you have narrowed it down specifically to the ingredient fish, it's certainly possible. Food allergy symptoms in a cat, it's really very specific. Food allergy is generally limited to the neck up. So what we are going to see is itchiness, redness, and sores on the neck, ears, around the eyes, and around the mouth. So if you're seeing sores and itchiness in the ears and around the mouth, that very well could be a food allergy. So I would recommend staying away from fish and seeing if the problem resolves. Now, with that being said, there's some foods out there that might say it's chicken flavored, and it may still have fish in it. So you need to read the label and make sure that it doesn't have fish in it.
There are some really great brands out there that have limited ingredients, and those foods will say one protein only on the can or on the bag of food. So just make sure that you're reading the ingredients to stay away from something that your cat might be allergic to. We have a couple of questions on our Facebook Live. Annette says, my cat is 99 in cat years. She still seems healthy. How much longer do you think her 9 lives are going to last?
Well, the longest cat on record just turned 30, so age is unlimited. As long as she stays healthy, she could live a long time. So as long as there's not any health problems going on with her, she could keep going. So,
do you recommend more routine vet visits for cats that are older, every 6 months maybe instead of every year?
Yeah, every 6 months is a good idea as they get older like that. And of course, watch for the common things: weight loss, increased urination, increased thirst, not wanting to eat. Those things are all signs to watch for.
I have an 18-year-old Siamese myself who is hyperthyroid and in beginning stages of kidney failure. She takes medication every day, but otherwise she terrorizes me just like she was if she was 10 years old. So she is probably going to live for a while, but she is infrequently. I weigh her every Sunday to make sure that she's not losing weight. So those are good habits to get into if your cat is older. Jeannie says, given my history of cats with heart disease and finding out too late, what can I look for to find these issues sooner?
That's a difficult question to answer. Heart disease in cats is very difficult to diagnose. It's what we call occult, meaning hidden. So unless they have some sort of a heart murmur, we a lot of times don't know that they have heart disease. Some breeds are predisposed to heart disease, and we might do a screen on them to try to determine if they have heart disease. Persians and Maine Coons are the main breeds for that. We don't have a cardiologist nearby. The closest one is in Manhattan at the vet school. He's obviously very busy. He's really the only one in the Midwest, so he's very busy. He's difficult to get an appointment with. So if you have a young cat that you are concerned about that you think may have heart disease, you could get an appointment with him for what's called breed screening, and he can do an echocardiogram, which is an ultrasound on the heart. It's not very expensive, and it can be done while you wait. It takes just about 30 minutes to have that done. There's also a blood test that can be done. It's called cardio-pro-BNP, and it's meant to be a screening test. It's not a definitive test, and what it does is it tests for cardiac enzymes to determine if there's any sort of stretch or any sort of early hypertrophic cardiomyopathy that might be going on in the heart. But it's meant to be a screening test to see if it's positive for that. Then that's going to be a reflexive test to say, okay, now we need the echocardiogram to be done.
Okay, good. Kelly says, our cat has started yowling at nighttime. He is 13. He isn't lost or upset during the day, just at night. What would help?
Okay, that actually could be a symptom of hyperthyroidism. So my recommendation would be to take your kitty to the veterinarian and have some blood tests done, especially if there's been any sort of weight loss. That could be an indication that there is something going on with your cat. So I would recommend a complete blood panel done on your cat with a urinalysis as well.
I would like to know Dr. Jones's opinion on Albon versus Panazeril for coccidia. If for all of you rescue people, if you're watching this, might be something good for you.
Okay, so first of all, coccidia is a parasite that dogs and cats can get that causes pretty bad diarrhea, usually in kittens, but it is very contagious, can spread between kittens and adult cats very quickly, and it causes really bad diarrhea. I like Albon. I know there's a lot of things out there on the internet that says Albon is really bad and doesn't work, but Albon is very inexpensive, especially for rescues. It's very inexpensive, and I've had really good luck with it as far as that working. It's about half the cost of Panazeril. The only problem with Panazeril is it has to be compounded at a veterinary compounding lab, so it's a little bit difficult to get, and it's off-label as well. And it's obviously twice the cost of Albon. The advantage of it is you only have to use it for 3 days versus about 20 days with Albon, so the duration is a lot less, but it does cost twice as much for just the 3-day duration.
Sure.
So what I typically do is I use the Albon first because it is so much less expensive, and if it doesn't work, then we can always go to the Panazeril.
Is there any difference on the Panazeril and the Albon as far as little kittens and their safety?
No, they're both really very safe drugs.
Okay.
Yeah.
All right. Well, let's talk about leukemia and AIDS-positive cats and their needs. So if you guys don't know, Kansas is the only state in the entire nation that does not allow the adoption of AIDS-positive cats. Very frustrating for rescues in Kansas. So a lot of rescues like ourselves simply get around this by not testing for it. Because there is so much research that say AIDS-positive cats can live with AIDS-negative cats safely and harmoniously as long as everyone's getting along and there's not a huge risk for cross-contamination. So,
okay, so you actually took the words right out of my mouth. So I would actually like to split that question up a little bit because there is a difference between feline leukemia and FIV. So with FIV, or feline immunodeficiency virus, as long as these cats are spayed and neutered, where they're not going to breed and they don't fight, they can live with other cats that are FIV negative. So there really is not a lot of limitations on those cats. I would recommend that they do still go ahead and stay indoors because we don't want them outside where they could potentially fight with other cats. So they would need to stay inside so that they don't fight and potentially get infections from bite wounds that they wouldn't necessarily need to get and potentially spread to other cats. Now, as far as feline leukemia goes, these cats can spread that disease. The vaccine is only about 95% protective, so other cats living with them, even if they are vaccinated, they're not protected 100%. So we do recommend that other cats living with them, they would have to be also leukemia positive. So the only other animals that they can live with would be other species like dogs, rabbits, birds, things like that, or other cats that are also feline leukemia positive. Feline leukemia is spread through fairly casual contact. It's spread through fighting and breeding, but it can also be spread through grooming, sharing water bowls, litter bowls, things like that. And it's nearly 100% fatal. These cats usually live just a few years, and once they get sick, they die usually very quickly. Some cats have been known to live a lot longer, but that's rare. Most cats only usually live a year or two.
We have not seen a huge number of cats or kittens that have tested feline leukemia positive, but it has happened.
Yeah.
So definitely something that if you're going to be bringing a new kitty into your house, get everybody tested before that happens and make sure that everyone's going to be safe to live together, which is actually a really great precursor into I just adopted a new cat. What's my first step? Like, I want to come to the vet. What should I do for my first vet visit?
Okay, well, first of all, if you have another cat at home, the first thing you want to do is make sure you keep those two cats separate because you never know what that new cat has. It could have something really pretty bad, like feline leukemia, but it could also have some other things that are bad, like a nuisance, like ringworm, coccidia that we just talked about, ear mites, fleas, things like that. They can be a bit of a nuisance that we can treat that aren't going to kill your other cat, but that can spread to your other cat and even your dog if you have a dog. So you want to make sure you keep the new kitten separate until we have a chance to check it over so that you don't have a big problem in your house that we have to do a lot of cleanup on. So until you have that first vet visit, I recommend trying to keep the kitten separate. And then once we get it in, I do recommend feline leukemia testing as long as it's old enough to do that. A lot of times we see these kittens when they're 4 or 5 weeks old and they're just too small to... Hi! That's Ollie. Oh, no, that's Poe.
This is a cat-friendly vet, so we have kitties running around, and he's been really, really interested in what we're doing.
Yeah, he's been noodling around with the camera. As long as they're old enough that we can get the blood sample to do the leukemia test, we do recommend feline leukemia testing. And then either doing a stool check to check for parasites or just doing a general dewormer on them. Now, if they're having diarrhea, we do recommend doing a stool check on them to make sure they don't have coccidia or giardia or some sort of parasite in there that could transfer over to the other kitties. And then as long as they're old enough, we do recommend giving them their first vaccination.
So some people, if you have not been here to the Cat Hospital, Poe, who just greeted us with his presence, is actually a blood donor, as is his brother. So if you have a kitty that comes in that needs a blood transfusion, Poe or Ollie might help them out.
Yeah.
So animals need blood just like people do. So if someone's interested in getting their animal signed up for a donor, how would that work?
Well, actually, we just use Ollie and Poe for blood donors, and then we have a couple of other cats that we use as backup here. They have to go through a lot of testing. We have to test them so that they're negative for a lot of different diseases. So it's a pretty expensive process that we have to go through. We have to do blood typing on them and make sure they're negative for a lot of different diseases. So we wouldn't just take any client's cat for that.
Okay.
So that's why we keep these little boogers around here.
And put up with their shenanigans?
They have shenanigans.
Kelly asks, how can you introduce a new kitten into a home with an older cat?
Okay, that's kind of a lengthy question. Not trying to sell our website, but we do have on our website a handout on how to introduce, and it's a couple of page handout on how to do that. So it is kind of a lengthy conversation. But the easiest way to do that kind of in a nutshell is to keep the two kitties separate. So put the new kitten in a room by itself with everything that it needs, toys, water, bedding, food, litter box, everything it needs. And then try to introduce them through the door by feeding them something really yummy, like treats or canned food on either side of the door, as close as you can so that they're not interacting in an adverse way. So in other words, you want them to readily eat that food on either side of the door. As soon as you see that they're just immediately going to the door to eat that food and they're excited to eat it and they're not growling, they're not backing away thinking, ew, that kitty cat's on the other side of the door, then you can start to introduce them. But you want to do it when they're not face to face on either side of the door. Wait till the adult cat's in another room doing something else. Open that door, let the kitten come out at its own pace and investigate. If you see them interacting in a positive way, you want to reward them. So you never want to punish a cat. Cats react very adversely to punishment. So you never want to punish, you never want to scold, you never want to shout at a cat. All you want to do if anything bad happens is just split them up and try it again a different day. If things aren't going well, you could also put the adult cat in the room that the kitten is staying in for a little bit. You don't want to do it all the time, but for a little bit. This gives the kitten an opportunity to investigate the new surroundings, and it also gets him the ability to get his scent throughout the house in a non-intrusive way, and it also lets the adult cat kind of investigate the little room that the kitten's been staying in a non-intrusive way, and they get kind of used to each other without actually coming face to face with each other. And then try it again another day. So you just don't want to force them on each other. You want them to introduce slowly, non-aggressively, and try to get them introduced with toys, with treats, very slowly, very peacefully.
I will say my two girls have been together for 6 years, and my senior Siamese still hisses and growls on a daily basis. So she is old and grumpy and stuck in her ways, but everybody gets along. She just doesn't want anybody too close to her. So make sure that you're having realistic expectations with cats. They are very stuck in their ways. Lexi says, we have over 200 stray cats in my neighborhood. Most of the kittens are sick. They're inbred, gooey eyes, green snot. What is another way to get them caught to quit inbreeding kittens? I live in Clearwater. Dr. Jones is a big fan of TNVR, as is Wall. TNVR, if you are not familiar with that, is trap, neuter, vaccinate, and return. Two big things. You're returning them to where they came from, and you're vaccinating them before you release them. Studies have shown that vaccinating even one time for rabies is better than never vaccinating for rabies. So you're probably not going to be able to catch that cat to vaccinate it again in a year. But that's definitely something that we could help with, Lexi. If you want to shoot us a private message, we do have spay-neuter vouchers to help cover the cost of some of that, because that is a very costly undertaking. Yeah. Anything to add to that?
That covered it.
Okay. Well, I think we've answered everyone's questions. If you have anything that you can think of afterwards, definitely post them in the comments, and the practice manager here at Cat Hospital will chime in as she's able and maybe help be able to answer some of the questions later. You can go back and rewatch this anytime. It'll be on our Facebook page. And we will be back next month with another professional that you can ask questions for. So next month's guest is Mark Eby, CEO from Kansas Humane Society. He's going to be answering all of your questions, putting myths and rumors to bed, and we're going to be answering all of those hard questions that I'm sure people might have for Mark. So he's going to be in the hot seat next week, or next month. Keep in mind that this is not a replacement for regular vet care. You still need to be taking your animals to the vet. We're just hoping that we can empower some owners on what to look for in case their animal does need some help.
All right, thank you.
And Cat Hospital is here, intersection of Central and Woodlawn. Wonderful, wonderful vet clinic. They see a lot of our kittens in Walls Care and also my personal cat. So if you need a good cat vet, here she is.
Thanks.
Thanks, guys. We'll see you next month.